Within 2 weeks, 2 people reached out to our newsroom to find a similar solution. I sat down with a Missoula man and woman with different circumstances, but one goal: to get a kidney transplant. As of December 2022, according to the Life Center Northwest, out of the 174 Montanans on the organ transplant waiting list, 141 of them needed a kidney transplant. According to the United Network for Organ Sharing, only 51 Montanans received a kidney transplant in 2022. And the Montana Department of Public Health and Human Services says the Montana Medicaid program has only covered, on average, about 4 kidney transplants per year from 2020 to 2022. This leaves the others relying on private insurance or paying out of pocket for the surgery. Until then, most people with kidney disease continue dialysis.
I'm doing all I can to save myself. I do dialysis.
It's just sort of a drag on your life to be on dialysis, basically.
52-year-old Jerri Lewis and 46-year-old Jason Fellin are 2 out of the hundreds of Montanans on dialysis.
Every night when I lay down to go to bed, my last thought is, I have to get up in the morning and do this. And it's not like a little needle. These are 16 gauge needles. They are bigger than a toothpick. Almost like one of those turkey injectors.
Jerri started dialysis in February of 2022 and has since built an at-home clinic in one of her bedrooms that used to be a safe haven for her grandchildren.
I think they think I'm going to die and that I'm living my last years. And I tell them daily, I'm not going nowhere.
Jerri's family has a history of kidney disease.
My dad and his mother had it. My paternal grandmother, she passed away from it.
She was born with polycystic kidney disease and found out the condition was taking a turn for the worse after an unrelated hospital visit last year.
It's where your kidneys form cysts, and sometimes, like I've had one the size of a softball, and when they burst, it poisons your blood.
Jason was born with IgA nephropathy, an autoimmune disease that progresses over the years and causes kidney failure. He found out his kidney function started to decline around fall 2022.
I think it was mainly just kind of a panic. It's like, we have to kick off this campaign. I have to find a donor now.
After the initial panic of learning he would need a kidney transplant, he learned how to do at-home dialysis and started searching for a matching donor.
We told everybody about the campaign at work, and actually a few of my coworkers signed up, and so I was really touched by that.
Both Jerri and Jason have a family of their own and say it's their support system that keeps them going despite the emotional toll of dialysis.
I think it's just the same motivation that anyone has, to keep their life going. It's the people that are in your life and your family.
People here cared so much too. It's like, you can't not care about yourself because everybody else cares too, you don't want to let anybody down.
Jerri is on a quest to get to Washington State for a kidney transplant. She says she has a donor, but it's the travel expenses to get there that's causing a roadblock.
I'm not no quitter. I have not got no quit in me. I will not lay down and just die.
Jason is searching for a kidney donor and is planning to get the transplant done in Washington.
It is challenging to find somebody that matches and that also is willing to actually go through with it, because it is a big ask.
Jerri and Jason are just 2 Montana residents who have to travel out of the state for a kidney transplant. That's because there are no facilities to perform organ transplants in the state.
If you do come forward, you would have that feeling of impacting someone's life basically forever.
Jason is still casting his net in hopes of connecting with a willing, living kidney donor for transplant. And back over at Jerri's home,
I believe my community will come together. I have no doubt in my mind.
she remains hopeful that she'll be able to reach her goal of $8,000 to $10,000 for travel expenses to get the transplant done in Washington State.
In my mind, I'm young. I have got a whole life to live, and I'm ready to live it. And I'd hate to think that monetarily, money could keep me from living, but essentially that is the truth.
Anyone who would like to donate to help Jerri get to Washington for a transplant surgery can do so by donating to a nonprofit organization called Help Hope Live. That information is on your screen. The proceeds will go directly to Jerri. And anyone interested in helping Jason connect with a potential kidney donor can sign up at dancingkidneys.com. Of course, all of this information will be on our website. That's KPAX.com.